All right, everyone. Hello and thank you. So sorry for the slight delay, but we are here now. Everyone, this is Fonda McClain. Thank you, Fonda, for being with us today. How are you?
Fine, thank you. Sorry about the hiccups.
No worries. We are all here together and we're excited to have this conversation. Um,
Thank you.
yes, thank you. So everyone, I am Faith Boone. I am the founder of Boone Logic. Me and my team, we are marketing consultants for our healthy community, OHC, and we are so excited to offer this live fireside chat with Fonda McClain today through the OHCEngage platform. Today, we're going to be highlighting the invaluable contributions of community health workers and the critical role that they play in bridging healthcare gaps and reducing disparities. Our special guest today is Fonda McClain. She is a certified community health worker based in the Cleveland, Ohio area. And for the past 6 months, Fonda has been dedicated to visiting residents in the neighborhoods of the Cuyahoga Metropolitan Housing Authority, which is also known as CMHA. She witnesses the healthcare challenges in these communities firsthand, and she works tirelessly to address those. Thank you so much for being with us today, Fonda. Let's jump right in. So my first question for you, I want the audience to be able to get a chance to get to know you a little bit. So where are you from, and how did you get connected with the work that you're doing today?
I'm originally from Alabama, but I've been in Cleveland for most of my life. Greater Cleveland area. I went to Cleveland Public School Systems, graduated from there. Um, and the connection of the community in itself, I worked at St. Vincent's for 26 years. During that time working there, I used to support Kathy Kopinski, who worked there in the community a lot, doing screenings, educations, and distributions during the central area of Cleveland. Um, then as my journey continued, I came across a person, a nice young man by the name of Joe Black, who was doing a lot for Cleveland Central Promise in the Cleveland area. And he had brought in a class for community health workers that was facilitated by CSU and hosted by them as well. Michelle Williams actually brought the CHW model to Cleveland. So in doing that, hoping to help others that we were serving at St. Vincent's is to open up a whole different pool. Started doing like Toys for Tots distributions with now we know it as Remington College, but before it was NEC. With Darlene Grayson, actually traveled and did a couple of distributions just to learn what I was doing, and because I understood the why and how to do them appropriately and without offending everybody. You know, even though we all need help and support, sometimes it's hard to open up because our pride gets in the way. So doing it with a little dignity.
Have you seen that a lot, just people dealing with that struggle of being willing to be vulnerable?
Exactly, yes.
Yeah.
Especially when you're used to being that person that everyone can count and depend on.
Hmm. Hmm. So, in your experience, what are some of the most common health disparities that you see residents facing in the communities that you're serving?
So some of the most common health disparities I would say would be knowing where to get the information from. Okay, being able to understand the information that's given and learning what they need to know about um, what is the actual disparity for them, like taking their health, taking their medications, being adherent, transportation, just knowing where to go, who to trust in that community to get the help that they need sometimes is like the biggest disparity. Yes, we do have the food insecurities. We have the pharmacies now that's disappearing. We have a lot of changes with transportations and lack of transportation, right? Not understanding their insurances. So helping them connect that information, making sure that they understand what is there, how to use it, and how to make it work for their benefit. Not so much as just a standard of living in itself, but just that lack of knowledge, accessibilities, and different options, and being able to communicate without feeling being demeaned or less than.
Right, right. So, how do, as a community health worker, how do you disseminate that information to the residents? How do you educate them about monitoring their health and managing chronic conditions?
So we engage in like a patient care model from different formal training, right? But then a lot of times as we doing the education information for motivational interviewing, helping them set smart goals. We make sure it stays patient-centered. We're just an added a care partner for them, almost like a life coach, right? So we're just someone that's added to their life to support them. We want them to be able to sustain once we move on, but stay in connection with us. So we do, again, this more or less like patient-centered a model for them, and just connecting them to the resources and giving them that power to say yes, teaching them how to be that advocate for themselves and helping the next person.
What changes have you seen after you've been able to reach these residents in that way where they're getting this information? What changes have you seen in the individuals that you've helped?
I have actually seen where having those conversations, going over the information, breaking it down to layman's terms, to lay terms for them taking ownership, understanding why it's important to drink water, understanding why it's important to get up and move around, making sure that they are adherent to their medication. It's not skipping a day. If they skip a day and I see them after they skip 1 or 2 days, showing them, well, hey, you were doing good for a whole 2 weeks. What happened? What was the change? And if I'm able to identify that change to them, they see the impact it has on their blood pressure, their diabetes. So just that one-on-one connection and making sure that they know that you're in control. So once they take that ownership of being in control, weight has been lost, blood pressures has been reduced. They are complying with the screens, which is very important that the doctor is offering for them, making sure they keep up their blood work and their appointments, able to go out and walk, enjoy life a little bit more within the community as well as at work without feeling it's a burden.
Right. Okay. Thank you, Fonda. Thank you so much for that. So I actually want to back up a little bit. And I want to go back to, as I mentioned in the very beginning, you're a community health worker. So
Yeah.
can you explain to us a little bit, what is a community health worker? What is that model? And is it the one that was provided by the Cleveland nonprofit Better Health Partnership?
Okay, so a community health worker is similar to a coach, life coach. However, we are mostly a connector for resources in marginalized communities in the greater Cleveland area. We help, we are formally trained, and we have life lived experiences that give us the ability to go out and help close and bridge the gaps and improve outcomes for individuals. Um, Again, the training that we get along with our experiences make us more intentional as the support that we give our community, as well as working as a network amongst one another. That's a very good question because a lot of people don't understand what the community health worker is, our model, our profession, because we right now are not even looking at it as a professional entity. That's something that we are fighting for, but it's so imperative in the healthcare field at this time. We are reducing numbers. We are showing healthy outcomes when it comes to using a community health worker in a patient-centered model. So for us, we are that connector, we are that resource, we are that bridge. We are closing those gaps of disparities with the intentionality of helping someone to close the next gap by helping one another. So our model for most community health workers is making sure their health is their wealth.
As a community health worker, what are some of the challenges that you and other community health workers are facing? And how do you guys overcome that?
I would say the hardest thing is navigating a marginalized community is limited resources, housing, being able to connect to the resources and communicating and getting them out, make sure that actions are doable for the individuals that we're trying to connect to. Sometimes we might give them a resource, but they'll have 100 reasons why not to get to that resource. But we have to reiterate to them, we cannot do it for you. We can actually show you the steps, but we're allowed to go step by step with you. I have said in Jobs and Family Services to help someone to get their SNAP benefits renewed. I have said at CMHA, filling out applications, help showing them the process to go into applications. And someone said, well, they already was on there, so why do you have to do it? somebody else probably did it for them. And believe it or not, until you sit there with them and see the struggle they have to fill out that application or the answers they put on that questionnaire, you understand why they ask for help. And I just love the fact that they trust me enough to go with them, to be vulnerable enough to know that I would not take advantage of that or degrade them by doing so. And that's across the board. I mean, yes, I'm at University Hospitals. We have a phenomenal community health worker team there, but we also connect with Langston Hughes, with Cleveland Clinic, Metro Health. So we have our own network within our little CHW huddle in itself, supporting one another to make sure Cleveland individuals overall are taking advantage of what we can offer.
Do you feel like the community health worker model is helping to break a stigma about reaching out for help?
Slightly, yes. Because again, the question you asked, what is a community health worker, is one of the questions that everyone has all the time. So we have to tell them we're here to support you for the time that we are allotted. We are here to show you what help looks like, helping you to overcome different oppositions and show you how to thrive in the food deserts, in the places where there's educational base, and not being afraid to take advantage of that. And just helping them find their voice to advocate for themselves and make it more preventive health care being taken versus waiting till after hours. I don't have transportation. I'm waiting after hours to go to the emergency room. Taking someone else's medication because they had the same signs and symptoms, but it may not be the same exact thing that's wrong with you. So showing them how that doesn't work to their advantage and educating them what does work to their advantage, I think helps the best.
Thank you for that. So from your experience working with different residents, what are some actionable steps that individuals can take to take charge of their health today?
I would say first thing, if I had to advise them, don't be afraid to reach out and ask for help. Ask questions, make sure they keep a list of their medications, make sure they take their medications. Also, make sure that they have a backup plan. A lot of times things happen, right? As we lose weight, we might have to take lower that medication, and we might have an episode. So when someone comes in your house to help you, what do you do? Do you have ice there, in case of emergency? Do you have somebody in your phone? So we make sure we think not just in the moment, but what if moments as well. So just making sure that you're aware, knowing what medications to take, go to your doctors on a regular basis, make sure you keep your appointments, make sure that you are addressing any issues. I don't care if it's mental health, substance abuse, that you're eating healthy. If you don't understand what eating healthy is, don't be afraid to ask the questions and look for a physician that understands who you are as a culture. Sometimes different cultures have different perceptions. So it's okay. And knowing that it's okay if you don't feel with this doctor or this nurse practitioner or the community health worker, ask someone that is suitable for you. This is your health.
Yeah. Thank you so much. So I actually found out about Fonda because I saw an article from WKYC Channel 3 about her work as a community health worker, and I learned a little bit about some efforts that help to bring the community health worker model to our area. The National Institutes of Health funded $18.2 million for a program in both Cleveland and Detroit to see if grassroots efforts can make a difference in health disparity. And that is called Addressing Cardiometabolic Health Inequities by Early Prevention in the Great Lakes Region. Or the acronym is Achieve Greater. And that initiative pays for community health workers, nurses, and care coordinators to work with CMHA. The Better Health Partnership that I had mentioned before is a Cleveland-based nonprofit that partners with UH to offer the community health worker model of care to provide sustainability for the effort. I wanted to know, Fonda, a little bit more. How do you think And Fonda, I don't know where your camera went because I don't see you on camera anymore. 1 second. Okay, and it looks like we might be back. Fonda, I feel like I can hear you, but I still can't see you.
I can see you.
Okay, well, as long as we can hear you, that's that works.
I'm like, what happened?
I don't know. I don't know. But thank you for coming back, everyone. So sorry about that. And I'm not sure why we can't see her video, but we can at least hear Fonda's responses. So Fonda, I just gave a little overview of about the NIH funding and Achieve Greater, and also about the Better Health Partnership. And so my question to you is, how do you see grassroots efforts like these and community health workers contributing to long-term health improvements in underserved areas?
I see this being a phenomenal thing. Just to address, we're doing what we call Achieve Greater. And as you stated before, NIH funded program. It's not only here in Cleveland, but it's partnered with Detroit as well. And out of this actual funding, where we go into the community of CMHA housing, and we screen people, we do engagement events and other outsourced community events as well, where we actually screen for the program of Achieve Greater. Out of this program thus far, we have had community action boards where we work real close with Dr. John Asa, and he is actually doing a system dynamic model as well with this, and he's putting the finishing touches on it. This right here will show the value of community health workers' work, how impactful and what areas that our impact has sustained been found, meaning that ER, as I said before, for emergency room attendance, that's very high on healthcare, right? So we have reduced those numbers from going into the healthcare. We have improved the numbers of doing preventive screening. So by doing so, that shows that a reduction in preventable diseases, right? It also shows to improve not only households, but organizations and researchers that can do ongoing improvements where they can actually see the true gaps in healthcare, as well as reducing hospitalizations.
Right. Okay. Well, that's awesome, right? I mean, it's nice to know that there's so many efforts out there that are trying to move the needle, and every inch counts, right? So,
Yes,
as
definitely so.
Yeah. What advice would you give to other community health workers, ones that you interact with or don't, that are facing challenges in their field of work? Just what would you tell them to motivate them or to keep them going forward?
Don't be afraid to reach out. Make sure you're not just an advocate for the patient, but for yourself as well. And ask for help and make time available to give help as well. A lot of times we ask for different resources in the community, but as well, we have to be willing to go back into the community to help those resources that we have asked support from. Giving a good example, MedSurg is one good one. One of my colleagues, she always go to MedWish for support, right? And with that, we always go to MedWorks to volunteer. So it kind of balances out, helping community resources, helping community advocates, helping grassroots. Because a lot of community health workers don't just work in a hospital. We have a lot of people that does the work that doesn't have the title of community health, right? We know mental health is something really big here in Cleveland. You have people such as Walter Patton, who does ghetto therapy. You have Vision Change that actually is in the neighborhood delivering meals on wheels, helping support food pantries, distributions for clothes. It's just a lot of things. So don't be scared. I would say don't be scared to get involved. Don't be scared to ask how to do what you don't understand, when you don't understand what to do, is what I would say. I mean, because it's a team effort. It's a team effort, especially until we get recognized as a profession per se. Right now, we just have a hard certification, but our push is becoming an actual professional.
Right. Well, Fonda, thank you so much for joining us today. Everyone who is listening, we are going to have a Q&A with Fonda, but before we get to the Q&A, I just wanted to ask her a couple of more questions. Fonda, it was really great to hear you share your story today and talk to us about the community health worker model and how it's helping to eradicate health disparities, not just in Cleveland, but everywhere. For the viewers that are interested in supporting initiatives like Achieve Greater or the Better Health Partnership, can you give any steps on what they can do to get involved?
The only step I can give is to give us a call. The phone number in itself is 216-844-0740, and you will actually be calling the Achieve Greater line. There, you will be able to go through the screening process. I can give you the qualifiers are from 40 to 75. You do have to have one of four, which is hypertension, high cholesterol, diabetes, or obesity probabilities in order to qualify. But just give us a call. Give us a call. One way or another, we can help.
Yeah. What's a message that you would like to share with the audience about the importance of community health workers in reducing healthcare disparities?
That it is a real job. We are intentional in doing our job, and we are committed to helping add value to not only healthcare, but making sure we add health as wealth in our communities. We want a healthy community. We don't want just neighbors, organizations in our communities. We want to have a community again where we can all come out and know one another.
Thank you so much, Fonda. I super appreciate all of that. We did have a couple questions come in through the chat, so I'm going to share those with you. The first one came from Silas Buchanan, who says, thank you for such a compelling session, Fonda. Who do you believe is best positioned to pay for the services that CHW provides? Is it payers, providers, or social service agencies?
I would say payers and actual social service agencies. If they allow community health workers to become a profession, we already can get our NPI numbers, but if they allow us to add on, instead of having different entities be the middle person and allow us to contractually do the work, I feel as though they would get even more of an impact of a community health worker.
Wonderful. Our next question comes from Sam Plabell, and Sam writes, as a community health worker, do you experience pushback or mistrust from patients, the community, or other professionals? And how do you respond to that? She has a follow-up question as well, but I'll wait until you answer this first one.
The answer to your question, good question, both Silas and Sam. Yes, we do experience pushback, and it does have because of lack of trust. Far as providers and other professionals, they do not look at community health workers as an ally or informal partner or informal co-worker as of yet, because again, a lot of people do not understand the use and how to use a community health worker advantageously.
And also, this is Sam's follow-up question. How do you or how can others help raise awareness about the community health worker model and the positive impact that it is making?
Great question, Sam. So bringing awareness about community healthcare workers. We have different associations for community health workers. We are actually educated through Cleveland State, which have different initiatives. We have peer support counselors, HIV support counselors there. We also have Tri-C. They have a whole new initiative this year for community health workers. And not only, because it just started off with those two, right? Now we have John Carroll and Kent State have community health workers tagged on as certifications as well, where they're actually doing air quality control research, which I think is an excellent thing for community health workers. So we're getting small momentum, but just pushing us out there when you see that we're asking for support nationally or locally would be a great help.
Thank you, everyone who submitted questions. Before we wrap up, Fonda, I just have one question of my own. What is the future for the community health worker model? Where do you see, I hear you saying that you guys aren't seen as a true profession yet. Is that coming down the line? Do you feel that this will grow and that this will continue to help our communities prosper?
There's a, woo, you all have these stellar questions. So, yes, we're pushing it to grow. It is getting kind of worried for some, especially the ones in the hospital that hit the glass ceiling, right? But there is a strong team behind us. We even have Angela Dawson from Minority Health. She's a good supporter of community health workers. Every year they put out with Impact Ohio, they're a good support of community health workers that hear our voice and take it to the administration to, so they know that yes, we're under the board of nursing, but again, help support us so we can support our communities and make it more viable. So yes, I do see that growth. I do see us pushing for that as we pushing, bringing that support and make it a little bit louder for them to know that we are here, we're here to stay, and we're here to make a difference.
That is so wonderful. Thank you so much again, Fonda. Thank you for answering all the questions and for sharing your story. Thank you everyone who showed up today in the audience and for sharing your questions for Fonda as well. We hope to have more of these live fireside chats, and we hope that you got to learn a thing or two. Thank you so much, everyone, and I hope everyone has a great day.
Thanks. Bye.
Thank you. Bye-bye.